And you have 5 minutes.
Yes, thank you so much. My first question is for Dr. Lane. Dr. Lane, can you speak to how trauma and how necessary trauma-informed schools are at this moment as to support not just our foster care population, but all of our students after we come out of this pandemic? Can you speak to the trauma-informed approach to education?
Yes, sir. Obviously, as our students began returning back to school at the beginning of the school year, and as some are just returning now, as parents were hesitant or school divisions have been opening, our students are facing a lot of trauma. Many have seen family members pass away in this pandemic. Many have seen significant illness in their homes. And it's important for our schools to understand the trauma that students are going through and have strategies in place to respond to that trauma, to be able to successfully make sure that student is prepared to learn. We all know, we talk about, Maslow's research. Students have to feel like their safety and psychological needs are met before they can learn. And that's what trauma-informed care is about. And so we work diligently in the Commonwealth through our agency to partner with school divisions and provide resources and support to make sure that our students have the wraparound supports necessary to make them successful in our schools.
Thank you so much. My next question is for Dr. Linda Coates. Dr. Linda Coates, as a former educator, I've seen firsthand just how difficult it is to nurture the growth of a child, especially when considering the roadblocks to success many foster youth face. Speaking with stakeholders in my district, such as the Good Shepherd Services and other organizations that support foster youth and those experiencing homelessness, the issue of special education became a reoccurring theme of conversation. In particular, I worry about the foster children with special education needs. In the absence of a parent solely concerned about the well-being of their child, I worry that many foster children may fall through the cracks and fail to receive the specialized education they are legally entitled to. How can we make sure that every foster child receives the individualized education plan they have a right to? What can the federal government do to best support foster parents as they advocate to give their children the education they deserve?
So good question. So the first thing is just making sure that the foster agencies are clear about what the IEPs for children who have special needs entails. And a lot of times the information that is in the IEPs that will support children and making sure that they make progress, whether it's during this pandemic or any other time, making sure that all of the stakeholders are clear about what the goals are. That for us is one of our major challenges. And so the first response that we have is making sure that our special needs coordinators who we have on staff are sitting with teachers and family members. And in the case of families who are children who are in foster care and or who are experiencing homelessness, making sure that everyone is clear about what those goals are. So for what I would recommend is to have funds that are earmarked specifically for the education of those large, in our community, we have a large umbrella organization that is responsible for coordinating the services. So making sure that there is enough funding to ensure that the children have and the families have access to those supports that are outside of the school. So if, for instance, children may need wraparound service. They may need a person to sit with them in the school in order for them to be successful during the day. Making sure that those supports are available, but also making sure that the stakeholders who are involved in ensuring that those supports are available are educated enough to know what they need to look for. So a lot of times we don't know what we don't know. And I think if there are funds that are specific to that cause, making sure that there is enough services available, and also making sure that folks are educated about the services that are available so that each individual teacher, parent, and child and service coordinator can sit down and make sure that the progress is being addressed. That's what I would recommend.
Thank you very